My name is Ludovico Cobuccio. I'm a medical doctor specialized in internal medicine with expertise in tropical infectious disease and digital health interventions. I'm in Rwanda coordinating a SSPH study where we test a clinical decision support system developed by Unisanté, University of Lausanne. And in these next 20 minutes, I will show how our tool compares to the current guidelines, paper-based guidelines. So I will show you how MedAL Reader, our tool, compares to IMCI. Just a quick step back, what is IMCI? IMCI stands for Integrated Management of Childhood Illness, and it is a systematic approach to children's health. The focus shifts from the single disease to the whole child, so it is a kind of holistic approach. It has been developed by the United Nations Children's Fund and the WHO in 1995. It consists of a chart booklet that provides guidance to clinicians. Clinicians have to systematically assess various problems, classify them, and identify the appropriate treatment and management. The first step is to check for general danger signs. That would prompt to give an urgent treatment and to refer the patient. If no danger signs are identified, then clinicians have to assess the main symptoms. Here is cough or difficulty breathing. So for each main symptom, the clinicians have to ask, then they have to look, listen and feel. In other words, they need to take a patient history and perform a clinical exam. And when they have done this, they have to classify the problem and provide the appropriate treatment and management. So here's another example for diarrhea and for fever. On the other hand, our tool, our clinical decision support system, it is a suite of different, several components. The main components being MedAL Reader. So it is an Android app. And this app, as the name suggests, it is a medical algorithm reader that can read various algorithms. For example, ear problems, malaria, pneumonia, diarrhea, and so on. All these algorithms charged on the app are collectively called EPOCT Plus. EPOCT Plus it stands for Electronic Point of Care Tests Plus. Okay, let's see how we can manage a clinical case, first with IMCI, then with MedAL Reader and EPOCT Plus. We have a 2 years and 3 months old child with fever since 2 days. IMCI is put into practice using registries that clinicians need to fill with administrative information such as the client's name and the caregiver name, age and sex, 27 months, female, then basic measurements, which are usually already available, having been taken before by other staff of the health center. So we already know Asia is 9.4 kilograms. She's 81 centimeters. She has no fever currently, 36.9. The clinicians then need to see if there is any danger signs and then assess all main symptoms starting from respiratory problems. So there is no sign of danger signs. We need to ask now, we need to take patient history and ask if there is cough or difficulty breathing. We discovered that Asia had 3 days of cough. Now if we need to follow these, we should move to the physical exam to measure the respiratory rate, to look for signs such as chest indrawing and stridor. We perform these and we see that the respiratory rate is 52. There is no chest indrawing, no stridor. Now we need to decide if 52 is too much or is it low enough. To do that, we need to refer to the guidelines, and we see that for children above 1 year of age, the cutoff to classify for fast breathing is 40. So Asia, having 52, is classified as having fast breathing. What does it mean? Let's go back to our guidelines. Fast breathing classifies the child as having pneumonia. Then we will need to propose this treatment and management. Okay, there is pneumonia. Then we need to move to the next conditions. We need to check for diarrhea. There is no diarrhea. We need to check for fever. Yes, there is fever since 2 days. And we will need to ask for these questions. And then perform some clinical exam. Again, other clinical exam. And sending the child to the lab to perform a malaria microscopy. There's no fever more than 7 days. There's no diarrhea, no vomiting. There's no stiff neck. We will need to send the child. Remember, we will need to send the child for this. All these are absent. There is cough, but there's no generalized rash, skin rash. So all this is doesn't need to be filled. So there's no measles. And all these can also be discarded. We can then we can't classify the child for this as long as we do not have the microscopy or rapid diagnostic test for malaria. We can move to the next problem. There is no ear problem, so all these questions can be skipped. We need to screen for malaria. For that, we will perform a physical exam, seeing if she has a palmar pallor. There is no palmar pallor. Then we can classify as no anemia. Oh yes, and we can also classify as no ear problem. Okay, I won't go through all the remaining sections because, as you have seen, it takes quite a lot of time, and I assume you got the point. Just quickly show what was left without details. So nutritional status would have involved to take some clinical exams, some basic measurements, but also plotting weight against height to determine where the child is in regards of her nutritional status. We would have ended around here, and also we would have done HIV. What else? We would have done also a TB assessment, vaccination status, deworming, vitamin A, feeding evaluation, other problems such as skin disease, or urinary tract infection, intestinal parasitosis. The clinician should have also specified the treatment and the posology, having advised also the mother on how to feed the child, give instructions on when to come back, and also finalize the consultation by signing. So in short, you've seen that IMCI involved quite a lot of back and forth between patient history, clinical examinations, then back to patient history, then labs, and so on. Now let's move and let's see how we can manage the same clinical case with MedAL Reader. Okay, let's open the app. Unlock it. And here I can see my patient is already there. My colleagues at the registration station entered the created a record and entered the administrative information. The first step for me as a clinician is to reassess if there is a life-threatening emergency. In this case, there is no problem right now. Then we can move to the complaint category selections. And here the main complaint was fever, so we can select fever. But this is also the opportunity to quickly screen through all these other conditions. For instance, I can ask, is there any cough or difficulty breathing? Or is there any diarrhea, vomiting, or feeding problem? No. And so on for all these conditions: ear, throat and mouth, skin, hair, eye, neurological, accidents, genitourinary problems, and so on. Here the objective is to quickly trigger a set of questions, the most appropriate ones, according to the reason for the visit. And here I can see that the basic measurements have already been taken by my colleagues during registration. I will just reconfirm that there is effectively exactly 11.3 as a MUAC, and here the tablet will prompt this warning message informing me that the MUAC is very low, and this means that the child has probably a severe acute malnutrition. And it asks me to double check if I'm sure about this. Yes, I'm sure about this. And here we can see that automatically the tablet has already plotted the anthropometrics, weight, height, and MUAC to give me the standard deviation, the Z-scores, to already categorize the child as having malnutrition up front. This is extremely convenient because in this way questions will be adapted in regards of this problem. Let's go next. Here we start with the patient history, so the Ask section. First, as in the IMCI, we will check if there are any danger or priority signs. I will say there's no problem right now. Then we are prompted to answer to this question: is there fever? Yes, there was fever. Answering to these questions triggers another follow-up questions, which is the duration of fever. We know it's 2 days. And cough, is there cough or not? Yeah, there is cough. And we need also to say if there is how long the cough is there, if there is any difficulty breathing. If there is barking cough, it could be a sign of a viral infection, laryngotracheitis. Say no. I can listen to the child. She is not having this clinical symptom or sign right now. Then we go system by system and see if there is any problem with the gastrointestinal one. None. No ear problem. No recent close contact with somebody with tuberculosis. And the child has no known comorbidity. No relevant past medical history. We also use this opportunity to screen for a risk of HIV infection by answering to the question whether the mother knows her status, her HIV status. It is negative. We can move forward. And we can go directly to the physical exam, knowing that we already answered to the most relevant information we had to ask. Is there pallor, conjunctival pallor? No. No palmar pallor. We are screening for anemia here. Is there edema of both feet? We are screening for the nutritional status. As we answered yes to cough, we need to also give more information on the clinical examination. Is there any chest indrawing? No. What's the respiratory rate? It's 52, if I remember well. As we enter the high respiratory rate, the app automatically advises us to also take oximetry to see how much blood, how much oxygen there is in the child's blood. And I would say it's quite okay, 95. Is there any pathological sounds like wheezing or stridor? I can safely say no. In case I'm not sure of what's the question about, I can always click on this little information info bubble, where we can have an explanation of what's the problem at hand. In this case, we can read that wheezing is a high-pitched whistling sound a child makes when breathing, especially when exhaling. And in the next version of our app, we will also have the ability to play sounds and to show videos. Can go back, then I need to check if there is jaundice or generalized skin rash for the skin, hair and mucosa system. Is there any stiff neck? These questions with a small warning sign and a red background are questions that will trigger an urgent referral. In this case, stiff neck could be a sign of meningitis. Having done that, we can move to the next step, which is the tests. So, at this moment, we will send the child to perform all these tests in the lab, and then when she comes back, we can fill in the information. Microscopy for malaria was negative. Blood glucose was asked because of the malnutrition status. I can say it is 8 millimole per liters. The appetite taste test, so this was the test to see if the child is able to finish his ready to use therapeutic food portion. I would say it is passed. Oh, sorry, yeah, passed. Hemoglobin has been also suggested because of malnutrition again, because it could prompt an urgent referral. Hemoglobin in this child was okay. Or let's assume that hemoglobin was not available. The machine was broken. Let's click on that. The app will ignore this question then. And I notice here a new question popped up. Did the patient eat or drink in the last 8 hours? No. This question is to help to how to interpret the blood glucose in order to determine if the patient is fasting or not. And we can also add any additional test that the algorithm did not propose. For instance, let's assume I decide to do a stool analysis. Then stool microscopy will pop up, and I can select the result. It is negative. When I click on next, then we have the list of potential diagnoses, and here we have uncomplicated severe acute malnutrition, pneumonia according to IMCI, suspicion of tuberculosis. All children here in Rwanda are screened for tuberculosis if they present with malnutrition, hyperglycemia because of the high value entered in the glycemia. Let's assume I agree with all of this. We also have prevention and screening, which always pops up to address the vaccination status, vitamin A, deworming. Let's say I have time to do that. I can click on next. Then we have more questions just to further refine the how we will manage and treat this child. Here we have the questions related to the prevention and screening. Did the child receive deworming medication recently? Yes, but she has not received her vitamin A. Her vaccinations are up to date. Here, because we should screen for tuberculosis, we need to decide if we want to do the screening here, if the health facility has the capacity to do that. I would say no. Is amoxicillin available? This is to decide which antibiotic to give this child. We will see why we are giving an antibiotic. And on the next step, we have the list of conditions with the black background. So we have uncomplicated severe acute malnutrition, pneumonia, suspicion of tuberculosis, hyperglycemia, prevention and screening. And for each of these conditions, at this stage, medicines, we need to decide if we agree or not with the suggestion to give a drug. Any feverish, malnourished children under 5 years of age should receive an antibiotic. So I agree with that suggestion. For pneumonia, we also need to give antibiotic. We will see how these apparently contrasting questions will be resolved. You can already see here that since I selected to give amoxicillin high dose, this overcomes the suggestion to give normal dose of amoxicillin. Then paracetamol suggested because of fever. No specific drug for the suspicion of tuberculosis because we want to first screen the child for this condition. Hypoglycemia, nothing to give at this stage. And because we said that vitamin A was not administered recently, the app also suggests us to give this drug. When you click on next, we reach the end of the formulation stage. That's where we decide specifically which posology and which way of administration we want. For amoxicillin, we can select 250 milligrams tablets or 125, or maybe we will want to give syrup. For paracetamol, the same applies. We will give 100 milligrams tablets available here in Rwanda. And vitamin A, we need to select what kind of solutions do we have. I will give capsules. Once we've selected that, we reach the summary where, as the word suggests, we have the final summary compiling all the conditions in black background with black background, and for each condition we have all the drugs suggested, all management and counseling. The same for all conditions. So let's take, for example, the antibiotic. Here we have already the posology, what the clinician should write on her prescription. 18.8 milliliters of amoxicillin high-dose syrup every 12 hours for 5 days, taken twice a day on an empty or full stomach. Let's see how management and counseling work. Here, because of hyperglycemia, the app advises us to transfer the child to the outpatient diabetes clinic. We can have further information clicking on this. The patient has high blood glucose. Refer the child to a diabetes clinic in order to receive the appropriate care. Okay, I can click on next. this last section is a specific section we have in our research project, where we want to know what the clinician do with the patients. So we ask the clinician to tell us if they refer the patient for an hospitalization, or if they refer the patient for an outpatient consultation. In this case, I agreed that this child would need a diabetes consultation. So I will click on here, other outpatient referral. Once this is done, I can press next, and the case is finished. The patient has been managed with our app.